Welcome to Ortho Reports. Today, we're diving into a medical case report that details an injury so rare and so severe, it's almost hard to believe. It's a story of incredible trauma, yes, but an even more incredible recovery.
So let's just jump right in with the central question this case poses. What happens when the hip, the knee, and the ankle on the very same leg all suffer a catastrophic failure at the exact same time? I mean, is it even possible to save a limb like that?
All right, so picture this. A 41-year-old man is rushed into the emergency department. He's been in a high-speed motorcycle accident, and one look at his left leg tells you something is terribly, terribly wrong. It's deformed, it's shorter than the other one, and it's twisted in a way a leg just shouldn't be.
Now, the doctors are looking at what they call an ipsilateral injury. That's a key term here. It just means all the damage is happening on the same side of the body. And that's what makes this so incredibly dangerous. It's not just one break. It's the hip, knee, and ankle all failing at once, compromising every single structural support in that leg. Okay, so they rush him to imaging, and the initial x-rays, well, they start to paint a pretty grim picture. What they reveal is this cascade of devastating injuries, a true anatomical catastrophe that's hit all three major joints of his leg. First up, the hip. We're talking about a massive amount of force here. The ball of his femur was knocked completely out of its socket and pushed backward. As if that wasn't bad enough, it actually chipped off a piece of his pelvis on the way out, what's known as a posterior wall fracture. Then, as you move down the leg, the knee is in a similar state. It's also dislocated backwards, which is a really severe injury. And on top of that, there are multiple fractures in his tibia, the main shin bone, right there below the joint. Oh, and his ACL was completely torn.
And finally, all the way down at the bottom of the limb, the ankle. He has what's called a bimalleolar fracture. You know those two bony knobs on either side of your ankle? Yeah, both of them were snapped clean through, which made the whole joint incredibly unstable and partially dislocated.
And look, don't just take my word for how serious this is. The actual case report from the Journal of Orthopaedic Case Reports puts it bluntly. This isn't just a series of bad breaks. This is, and I quote, a limb-threatening orthopedic emergency. The survival of the entire leg is on the line.
In a situation like this, you have to understand the ER becomes a race against time. When joints are dislocated like this, the major blood vessels that supply the leg can get stretched, pinched, or even torn. The team has to move fast to prevent permanent damage.
And what happens next is this incredible high-stakes choreography in the ER. First, they stabilize the patient's vitals. Then, they have to physically pop each joint back into place, a reduction they call it. First the hip, then the knee, and all the while they are constantly, obsessively checking for a pulse in his foot. Is the blood still flowing?
And that risk? It is absolutely massive. That number, 18%, is terrifying. That's the approximate chance of damaging the major artery behind the knee in a dislocation this severe. If that vessel is compromised and it's not fixed fast, amputation becomes a very, very real possibility.
So, with the joints back in place and a good pulse confirmed in the foot, the immediate threat is over. The leg is saved, for now. But it's still, a puzzle of shattered bone. So the focus now shifts from the ER to the operating theater for the long, complex task of reconstruction.
After getting a much better look with CT scans and an MRI, the surgical team had a big decision to make. Turns out the hip, once it was back in the socket, was actually pretty stable. So good news there, no surgery needed. But the knee and the ankle, well, that was a whole different story. They were completely unstable and would need some serious hardware to put back together.
For the knee and ankle, he needed what's called an ORIF. That stands for Open Reduction Internal Fixation. You can basically think of it as high-end carpentry for bones. Surgeons go in, meticulously piece the bone fragments back together like a jigsaw puzzle, and then lock everything in place with a whole bunch of metal plates and screws.
But, the surgery, that's really just setting the stage. The hardware provides the scaffolding, but now the patient's body has to do the real work of healing. His journey moves into the long, grueling, but absolutely critical phase of rehabilitation.
In this timeline, it just shows you that methodical, step-by-step comeback. It starts slow. At 2 weeks, no weight on it at all, just gentle movements. By 6 weeks, he's finally allowed to start putting some weight on it. And then, the incredible part. At just 6 months after an injury that could have taken his leg, he's walking, completely on his own. And if you want to see that recovery in hard numbers, just look at this table. We're looking at his knee's range of motion, how far he could bend it. You can see that steady, relentless improvement, from only about 60 degrees of bend at 2 weeks to an impressive 110 degrees by the 6-month mark. That's a direct measurement of a successful surgery and some seriously dedicated rehab. And the final result is, honestly, it's just astounding. This isn't just about being able to walk in a straight line. 6 months later, this patient could squat down and even sit cross-legged, totally comfortable. That shows an incredible level of stability, strength, and function that seems almost impossible given where he started. So, what's the big picture here? What can we learn from a case that's this extreme? Well, it turns out this one incredible story isn't just a medical curiosity. It provides a really powerful clinical message, a blueprint for success in the toughest trauma situations.
When you boil it all down, saving a limb from this kind of devastation is all about having a solid system in place. It hammers home the fundamentals, recognize how severe it is immediately, get detailed images fast, plan the treating in stages, ER first, surgery later, and, most importantly, have an entire team of experts all working together perfectly.
Which brings us to our final question. By documenting and learning from these unbelievable 1 in a million cases, how do we get better at handling the more common emergencies we see every day? This man's story isn't just his own. It becomes a powerful lesson in technique, timing, and teamwork that can help improve outcomes for countless other patients down the line. Thank you for listening to Ortho Reports.